The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to Local Women's Aesthetic Podcast. I'm Emma Heaney from Elite Aesthetics, and today I'm joined by Dr Dean St Mart from Supplement Needs. We're going to talk all things hair restoration today. Now we're going to talk past just surgery. It's about the scalp health, about the aftercare, and just about patience and longevity and expectations. I'm delighted to say that Dr Dean is actually one of my patients, and we've had a fantastic outcome for him, and he's going to share his sort of hair restoration journey with us today. So welcome.
Thanks a million, Emma. It's always a pleasure.
I really appreciate you coming on, because this is a topic for male and female. And you have been very open on your own social media with regards to your journey. And you've been very honest as well, which is refreshing.
Yeah. I mean, I guess in hindsight with my own hair loss, it was undiagnosed celiac disease, which shows you the importance of like your gut health and your nutrition, and then hidden signs of inflammation. So when we're looking at hair loss, like both male and female, it's always looking at like sex hormones like DHT, local DHT production in the scalp, and that's creating inflammation, and then the hair follicle shrinks and then the hair follicle dies. But a lot of people don't consider the impacts of their thyroid. So a lot of women will have thyroid dysfunction, or again gut dysfunction. They might have slight changes to the overall balance of their hormones. So estrogen, again, we look at testosterone towards hair loss. Estrogen is really important for blood flow to the scalp. So if we have low estrogen, we're going to have poor blood flow to the scalp. Poor blood flow means less nutrients. And obviously when we're using therapies like PRP or PRF, we're helping to encourage that local nutrition in the scalp by providing the substrates to help the nourishment of the hair follicle. I think when we're looking at hair loss, one of the biggest things that I look back in hindsight is the honesty to yourself that the hair loss is occurring. Obviously a lot of men will have like male pattern baldness and recession as they get older, and a maturing hairline. But when we start to see that recession occur quite quickly, we can often be sort of ignorant to the process, and then before you know it, the recession has occurred, and once the hair follicle is detached or died, you're not bringing that follicle back without a transplant. So it's really important that when the hair follicle or the hair shaft is starting to shrink and thin, that you intervene with strategies like PRF or other medications or nutrition strategies. And it's sort of, again, when I look back, 2021 was where the like genetic recession started to speed up really quickly. And that was around the time where my like celiac genetics started to switch on. But it's only when you look back in hindsight and you get to the end journey, you see the recession and you think, well, the only way to fix that now is a transplant. So I was very fortunate. I went and had a transplant done. They filled in both sides, like you've seen the recession of the before and the after. But one of the biggest things then after you do that transplant is the care of the scalp.
Yes.
And just because the transplant's a success in the beginning doesn't guarantee the future success of your hairline. So you're taking hair from the back, which is what they call androgen resistant. So obviously your hair on the back of your head never really falls out or thins or sheds. So something about that follicle is slightly different genetically, that it's not going to be influenced by your hormones. So by putting that in the front, something like male pattern baldness genetics won't influence that hair loss, but other things will, like thyroid, nutrition deficiencies, stress and everything else. And that's why it's important after the transplant that you take the diligence and the care of doing, your monthly PRF. And we saw a direct correlation that once we started doing the monthly PRF sessions, by month 6, my hair was like really thick and growing out.
Yes.
But what I will say from my own personal experience was that the hair quality is slightly different. Whatever is about the hair quality at the back of the scalp, so you're left with almost a wiry sensation to the hair that we then started on the nucleotide
That's
therapy.
right, yeah.
And within, again, we were quite diligent. We done that every week for 4 weeks. And by the end of the 4 weeks, the hair quality, again, it's softened. And even now the hair is completely different. The root of the shaft is completely different. That the hair quality is now nice and soft, and you don't have that wiry sensation where you know you've had a transplant.
Yes, because you can actually tell the difference in the hair, and we could notice the texture. And so what we did was polynucleotides, and a lot of people say to me, "Oh, they're really good for stimulating growth." I think they're a great product, but for me, it's for the quality of the scalp, the quality of the hair, and that's why we came in after the 6 months for that.
Yeah.
With the PRP or the IPRF, which is my preference. You were so diligent, but you never missed an appointment, and I think that was part of it. But well, you talked about your nutrition. Could we talk about like the supplements that you were taking as well? Because I can take the blood, but it's only as good as the value of the blood that I'm taking, that I spin and re-inject. So I think that's really, really important as well. Would you mind sharing what you were taking?
So what I put a big emphasis on are like essential fatty acids, so your omega-3s, trying to keep omega-6s relatively low. So you're focusing on things like fish oil, oily fish, salmon, macadamia nut oil, avocados or avocado oil, ensuring adequate protein, because you have to remember your hair is made of keratin, which is a protein.
Yes.
And then, just trying to keep a general, if you want to call it, anti-inflammatory diet of your like single ingredient foods. Don't get me wrong, still having some flexibility in nutrition of enjoying things, but I guess for me, being celiac, a lot of the nice things are taken away from you. So you do end up following just a natural low inflammation diet in that regard anyway. Another thing I think that was really useful was the tripeptide collagen supplement that I introduced to you. So we made Beauty Essence, which was a tripeptide collagen liquid supplement, which again, you're giving the growth signal for keratin and collagen to develop. So I guess when we're looking at even supplements, one of the things that can actually cause hair loss is too much vitamin A or too much vitamin D, or imbalances where you're not getting enough zinc or selenium, so you're coming back to the thyroid or the sex hormones. That it really, if you notice that the quality of your hair starts to thin with nothing really changing in the environment, then you have to ask the questions around like the gut and the overall nutrition that you're having day to day.
Yeah, as well as low iron as well. You get the hair thinning too. So a lot of my patients will be on zinc, usually magnesium as well, the iron, the omegas as well. And then we go back to your collagen, because it is a fantastic product, and I did trial it as well. And we're going to explore that a little bit further, but we'll do that off camera.
Yeah.
Your collagen was excellent, very easy to take, very easy to take. When we talk about, obviously some of our ladies aren't going to go for transplants, and you've got as you said, the drop of the estrogen, we hit the menopause, we get that thinning of the hair. I have a lot of those patients here. So what's your thoughts on their supplements? And do you think, I had this conversation with actually an American doctor recently about minoxidil and females. I personally think they're better on the 5%. I know it's just say they have a female dose and a male dose. What's your thoughts?
I think for what we look at minoxidil as a hair therapy, what you're doing with minoxidil is encouraging blood flow and nutrient delivery to the scalp. What I will say, there is some interesting theories with minoxidil when you look at like cell culture expression, that it can actually interfere with aromatase function. So obviously that's the enzyme that creates estrogen. There are some people that say it will block aromatase. There's others that suggest that it shouldn't. But in terms of the concentration, I probably would agree that I think it was more of a marketing step. If you look beyond it, that they created 2.5% for women and a 5% for men. To be honest, if you look carefully beyond the application for men, I think, was once per day, and women was twice per day, and ended up being the same thing. So minoxidil is a very useful thing, but most people have to bear in mind that your hair goes through a growth phase of the anagen growth phase, the catagen sort of resting phase, and then telogen, which is the sort of resting to get ready to leave the hair shaft or remove the club hair. Minoxidil will speed up the release of any club hairs that are pretty much at the end of their life. So you might find that you end up with more hair being shed, but what's coming through is a healthier hair shaft from restarting the hair cycle process. So with that in mind, again, what you're trying to view any strategy to improve hair quality is, how can we protect the hair shaft? So where it's oxidative stress, what you put on your scalp, like what you talked about with scalp health.
Yeah.
If you're putting very harsh chemicals on your scalp and you're not thinking about what your shampoo is doing or what the air quality is even doing to your hair and your scalp health, how that influences the hair growth cycle or the health of the follicle itself. Because again, if we're looking at hair loss, irreversible hair loss means that the follicle has detached from the scalp. So you've got a bulge of stem cells at the bottom of the hair shaft, and your hair grows from those stem cells. When that hair shaft detaches and falls out completely, that's where you have that irreversible hair loss. So what you're trying to do is protect those stem cells to keep them growing. And if that is a lack of hormone like estrogen, where there's not enough blood flow, like anything in your body, if you put a tourniquet on your arm and tied it real tight and you stop blood flow going to your arm's going to fall off eventually because there's no nutrients going to it. So the same as we viewed with the scalp.
Yes.
And that's where things like IPRF and then microneedling as a combined therapy, what you're trying to do is stimulate the scalp's immune system as one side of the growth equation, and also to encourage the immune system to come in and trigger off growth processes as part of the inflammatory cycle without creating like damaging inflammation.
Yes.
So it's with PRF, the thing I like about PRF is because you've got the fibrin and you've got the scaffolding proteins that would naturally build around the hair structure itself. PRP does do it to an extent, but you're missing the supernatant, what you spin the PRF at. That's critical to keeping those growth factors in it. Yeah. And then obviously you get a prolonged, like we discussed before, you get a prolonged benefit from the PRF over a period of 2 to 3 weeks, whereas with PRP, the effect can, I wouldn't say wear off, but it tends to be like very acute. That you
very short, yeah.
5 or 6 days, and then that PRP then has done its job, whereas PRF is slowly building in the background.
Yeah, I definitely agree that PRF is far superior to PRP. PRP had its place, but it's definitely, PRF is a far superior treatment.
I mean, if we look at, there is an interesting paper where they look at the success rate. Now, this is with a transplant, but similarly, we can probably extrapolate to normal hair, where they used PRF, where the unfortunate people who signed up for it had PRF done on one half of their transplanted hair. So, and then they measured the success of the side that didn't get versus the side that did get PRF. And they managed to save, from what I remember, in a centimetre squared area, they managed to save an extra, I think it was 6 to 7 hair shafts on the side that received the PRF, which right. If you think about it, success rate wise, the side that didn't receive it, the shaft that was transplanted didn't survive, whereas the side that got the nutrition and the nutrients from the PRF survived at a greater, probability.
Uh-huh.
And so if you're going in for a transplant and each centimetre squared area is losing a certain percentage of hairs, doing something like PRF, if you're saving 6 or 7 hairs per centimetre squared, it adds up to hundreds of hairs being saved on the scalp. And that obviously will create density that when your hair starts to grow, that you'll see a much better benefit than overall.
Mm-hmm. That's a really, really good study. I put out that you were coming on the podcast, so I opened it up for questions.
Yep.
So I've got a couple I'm going to throw at you. So the first one was, and these are quick fire, so did it hurt out of 10 when I did my treatments to you? So the PRF? I've
got a good tolerance for pain, so I think, I mean, the most painful part is probably the freehand injections of delivering the PRF. But if you've had a transplant and you've had like the local anesthetic injections to your scalp, it's about the same. So if I was to rate it as a number for like maybe a normal person, maybe 3 or 4 out of 10. But it's very quick, and you know you're very careful. So I think for some things there's probably a little bit of pain for the benefit to see the long-term benefit.
What he's trying to say is I'm really gentle.
Yeah.
Was it worth it?
100%.
Yeah,
100%. I mean, I'm 14 months now post-transplant. So January 2025 when I had it done. And I'm still coming back between the sessions of the PRF. I think we're now into like the 8th or 9th one.
Yeah.
So it definitely, and it's something that for the quality of where my hair is now, and like I said, if you could go back and speak to your younger self, like, value your hair while you can save it. Now heading into like my 40s, it's definitely something that's making me think about, okay, I want to keep the longevity of my hair.
Yeah. And I suppose the message from that is early intervention is key.
Yeah, if you're a 20-year-old and you're worried about your hair at that age, intervene if you want to keep your hair. If you're the sort of type, I guess, even for me, when my hair receded so much that I shaved my head, I didn't mind personally shaving my head, but my wife said otherwise, and that sort of that makes you question, okay, I need to get my hair back.
Yeah, and you've actually answered the next question by just saying that. So I want to take this opportunity to really thank you for coming on and for your frank honesty, because, I mean, people will be listening thinking, oh God, do I need a hair restoration treatment, do I not? So it's so refreshing for you to do that for me. But I think the key message is early intervention. Hair restoration isn't just about the transplant, it's about pre-care and post-operative care as well, and manage your expectations. So if you've got any questions about IPRF or what we offer here in Elite, feel free to reach out to us, and also reach out to yourself about the supplementation as well. It's been the dream team.
Yeah, thanks a million, Emma.
You're very welcome.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.